Hi, today we will learn about aminoglycosides.
Welcome to today's discussion on aminoglycosides, a vital class of antibiotics. Aminoglycosides are potent bactericidal agents. They consist of amino sugars linked to an aminocyclical ring. These highly polar and water-soluble compounds originated from Streptomyces and Micromonospora species. The prototype aminoglycoside, streptomycin, was discovered in 1944. Key point to remember, aminoglycosides are potent antibiotics primarily used against aerobic gram-negative infections. Let's delve into their chemical structure. Aminoglycosides feature a core aminocyclical ring, commonly 2-deoxystreptamine. This ring is attached to amino sugars via glycosidic bonds. Due to their basic nature, aminoglycosides exhibit poor lipid solubility, leading to poor oral absorption and limited tissue penetration. Next, let's classify aminoglycosides. They can be categorized based on their source or clinical use. From Streptomyces, we have streptomycin and neomycin. From Micromonospora, gentamicin and nettlemycin are notable examples. Regarding clinical use, aminoglycosides are classified into generations. The first generation includes streptomycin and neomycin for tuberculosis and topical applications. The second generation, like gentamicin and tobramycin, targets systemic gram-negative infections. The third generation includes amikacin, used for resistant infections. How do aminoglycosides work? They irreversibly bind to the 30S ribosomal subunit, disrupting protein synthesis. Step by step, the drug enters bacteria through oxygen-dependent active transport. Once inside, it binds to the ribosome, leading to misreading of mRNA and abnormal protein synthesis. This eventual damage causes cell death. Now let's explore the spectrum of activity. Aminoglycosides are effective against gram-negative aerobes, including E. coli and Pseudomonas aeruginosa. Their effect on gram-positive cocci is limited and often requires combination therapy. Notably, aminoglycosides are ineffective against anaerobes due to their reliance on oxygen for uptake. Bacterial resistance mechanisms include enzymatic inactivation and altered ribosomal binding sites. Other mechanisms involve decreased permeability and active efflux pumps, which help bacteria survive against aminoglycosides. Understanding pharmacokinetics is essential. Aminoglycosides have poor oral absorption and are usually administered via injections. They distribute within extracellular fluid and accumulate in the kidneys and inner ear. They are not typically metabolized and are excreted unchanged in urine. Pharmacologically, aminoglycosides exhibit several actions. They provide a bactericidal effect through irreversible protein synthesis inhibition. They work synergistically with beta-lactams to enhance antibiotic efficacy. Their rapid accumulation can lead to post-antibiotic effects, where bacterial growth remains suppressed even after the drug is removed. Therapeutic uses vary by drug. For example, streptomycin is used for tuberculosis, while gentamicin treats sepsis and meningitis. Tobramycin is effective for cystic fibrosis, and amikacin serves resistant infections. Adverse effects are significant. Nephrotoxicity is usually reversible, but ototoxicity can lead to irreversible damage. Neuromuscular blockade may occur, posing risks for individuals with myasthenia gravis. Contraindications include hypersensitivity to aminoglycosides and pregnancy due to teratogenic effects. Caution is advised in patients with renal impairment. Finally, be aware of drug interactions. Loop diuretics can increase ototoxicity, while nephrotoxicity may result from combining aminoglycosides with vancomycin or amphotericin B. In summary, aminoglycosides are important antibiotics with specific structures and classifications. Their mechanism of action disrupts protein synthesis, providing a targeted approach to treating infections. Understanding their uses, effects, and interactions can significantly enhance clinical outcomes. For further learning, explore your local pharmacy or medical library, and don't forget to check out our additional resources linked below. Thank you for watching.